students, because we only supported them, but every time we have events happening, they come and they show up. Now we are organizing a medical camp in Ukanga in August, and some of them want to come and volunteer. So I want to applaud you for that. Thank you.
You didn't say from which country in West Africa you are from? Cote d'Ivoire. Okay. Excellent. I went there when I was Deputy Minister for Sports to learn how the sports academy work in Cote d'Ivoire, because they have the best, according to UNESCO, best sports academy programs for the youth in Cote d'Ivoire is number one. By the way, thank you very much for your kind comments. This is us Tanzanians. We are waiting for a Cote d'Ivoirian to come and praise us. This is normal, but thank you very much. But I want to also to tell you something. I pray to my God that among your 3 kids born in France, US, and Tanzania, the one from Tanzania will make you very proud. I'm telling you, the one who was born here is the last one, right? It will make you very proud, and you'll remember me. If I'm there or I'm not there, but you'll remember me one day. But another thing, thank you for the support. Rotary, we are working with them also on many other spheres. And thanks for noting. You have been a good testimony. But this testimony to stay with you only and not giving outside. I hope Dr. Mariam and the professor here are going to use this opportunity of taking your story to go globally. Because it is because of your story, my president won an award. It's called Goalkeepers. She's not a goalkeeper, but she won a Goalkeepers Award here at Grand Hyatt from Bill Gates Foundation. And it's because of those stories. It was from Kigoma. It started from Kigoma all the way here. So once again, merci beaucoup.
Thank you so much, Nana. We have the ambassador from Morocco.
Thank you so much. You know, you're not the only foreigner in your household. Myself, all my kids are born outside. They see me as a foreigner. But, you know, you mentioned something, Excellency, very important. And this is, Tanzania is a country where we can find peace, security. But it's true that you guys are very humble. And what you don't communicate, it's not known. So there's a lot of things that in the past 3 years and a half, when I came here,
I witnessed a lot of development in many areas. In the area of health, because it's part of the vision for Excellency as part of other sectors, agriculture as well. So I stand here saying that Morocco is ready to collaborate with you. We have already an MOU that was signed in 2016 during the visit of His Majesty to Tanzania. But actions is very important. We can sign many agreements. If we don't action them, nothing is happening. Morocco launched, and by the way, proud to say that Professor Janabi was invited to the launching of that Institutes and Academy of Health, African Academy of Health and Science, which is something very important, which way basically the focus is to get together all the researchers from Africa, or all those that want to publish something that they cannot publish it globally, we can publish it continentally in our region, and a lot of exchange, training. So I believe, I don't know most of you, but today I was able to exchange some of your cards, because sometimes we're looking to invite more professors, more doctors to our country when we have some of these events. Morocco has been, and I can share with you the work that we've been doing in the health sector. In the past 20 years, the investment in the health sector is amazing. We have created more hospitals with university hospitals in the past few years than in the past 2 decades. And we have also scholarship for students. And His Excellency has lately sent a message to our, not our minister, on specific scholarship that Tanzania needs, specifically also in the health sector, and we will be providing that. That's not just to have Tanzania going to Morocco and study, but also there are opportunities of Moroccans coming here and experiencing some of those sectors. In the sectors, we also have something that is very important, which is pharmaceutical and other labs. You know, and we have few that are very much interested in coming. In fact, at the end of August, we have some from the pharmaceutical sector that I want to come here to Tanzania and experience and exchange and be able to implement themselves here. So, again, we will have to do something that the minister mentioned very well, which is the follow-up. We cannot miss the follow-up to actionate what we want to cooperate on. Thank you.
Thank you very much, Excellency, Ambassador of Kingdom of Morocco in Tanzania. And I would like to tell the head of this international department to start with an action plan immediately. Have an agreement with them so that we turn this theory into practical, this talk into practical. And number two, I'm due to visit your country very soon. So I'm telling you now, I'm not coming without Muhas. I'm coming with Muhas to Morocco. So please inform my counterpart there. I will come with Muhas. So prepare yourselves. Thank you.
Your Excellency, Ambassador, I'm actually a student of economic diplomacy, and I'm happy to know that Dr. Ulanga was part of the process in developing the new foreign policy. First, my question is, when economic diplomacy is taught, or because I went to the School of Diplomacy, is taught in the area, can they also include health diplomacy as part, because health cuts across all areas? That is one. But two, my question is, so what are the limitations that are currently the global health governance framework is facing in managing transparently health threats, and how can diplomacy address them? Yes.
First of all, it's a good idea. Thank you very much for the wonderful question. It's a good idea to introduce health diplomacy as a module in our CFR. Now it's called Dr. Salim, Ahmed Salim. So we are taking that as a good idea, and we'll trademark it or copyright it with you, that you gave us this idea. Although it will not be protected. We are going to take that as a good idea. I think it's a good idea, Professor, to include one module, little module of health diplomacy for your medical student. You will decide, either at undergraduate or postgraduate or other levels. You will decide. But I think it's good just to be aware, tutoke matongo ya macho, tuifahamu dunia. Mimi kilichonisaidia kuweko hapa, mimi sikusomea masuala haya ya diplomasia, sikusomea wala sikwenda SFR kama wewe. Mimi ni engineer. Yani najua zeros and ones vizuri sana hesabu, na ndio somo langu best ilikuwa hesabu, somo ambalo watu wote wanalikimbia. Nikwambie kwa nini nalipenda hesabu? Kwa sababu hamna anything extra from 0 to 9. Hakuna. Nitajieni kama kuna anything extra. Kwenye biology kuna, sijui kwenye nephrology kuna Bowman's capsule, kuna uriniferous tubule, kuna mambo kibao. Lakini kule 0 mpaka 9 ndo mwisho. Hakuna anything else. Hata kufanya integration hizo dx dy, lakini unarudi kwenye nambari mwisho. Kwa hiyo I think by saying that, it is important for us to borrow from each other whatever is good. And I think this, what you have mentioned, is extremely good that we can work on. That is number one. Number two, I think that the second question is more for them, for the health people. But please read this documentation. It's very important to read. Read the strategic plan, read my budget speech as well. All this information is there. Not many people read this budget speech. After it is read, Mula is laughing because she knows about it. Nobody reads. But Mama Mheshimiwa Balozi Mulamula, there is a lot in that budget speech. Very rich, 180 pages, something like that. I read only 12 pages in the parliament. And on top of that, the speaker cut me off, you know, to reduce my time. Can you shrink a research paper of 200 pages to 12 pages? It's almost impossible. That is excluding diagrams, eh? So, so I told you I'm a scientist, so I know how you think, but we think a little bit different. We approach the problem from outside, the medical people approach the problem from inside. This is our main difference. So, tumelichukua on board and we'll work on it. Thank you very much.
Thank you.
His Excellency, as you mentioned earlier, we as Turkey are in a good position in the global health, in the health diplomacy. So we are willing and ready to cooperate with you in the next term. Let's come together, let's discuss, let's determine a roadmap in the next term. We are willing and ready to cooperate with you. By the way, may I help you, His Excellency? May I invite you to Turkey to have a hair transplantation together. Thank you very much.
Before I come to Turkey, teach Tanzanians to do these makames and haji and all others. Teach them to do it here. I will do mine here, but you have to teach us because you have the technology.
Okay, thank you very much.
Thank you. Tashakure Daraba. 1 minute, madam.
Yeah, I just wanted to again thank the Turkish people, the government of Turkey. They provided an ambulance to MOAS through TICA. So this ambulance is used for teaching emergency causes, and also is providing service. So thank you very much for the support of the ambulance. Thank you.
Thank you very much.
From South Africa.
Thank you very much for your speech, Excellency, Honorable Minister, Vice Chancellor, and your professors and team. I greet you. Mine is just to say that as South Africa, we welcome this initiative of international diplomacy. And we are looking forward to interact with yourselves on the different aspects of health and all the related challenges. You would also know that South Africa is a very complicated country because we come from a divided past. We are trying to transform the health system so that it can be equal for everybody in terms of access, in terms of affordability, and so on and so on. So we need to learn from you because we are in the process of introducing the national health insurance for all citizens. So our health system is divided into public and private. So it depends how much you have in your pocket to access the best health care. So we welcome, and I think our ministers are already talking to one another in terms of engaging on how we can learn from Tanzania and Tanzania can learn from South Africa. As I end my short input, I would like to say thank you to Tanzania, because last year I had an accident. I fell and broke my leg. I couldn't walk for some time. The first people who attended to me were in Dodoma Hospital, where I was. And unfortunately, the doctor that was leading the process passed away, that young man. And there were assistants around him. I couldn't walk. I couldn't even get on the flight to Dar es Salaam. But the treatment that they gave me helped me to travel by car from Dodoma to Dar es Salaam asleep. That was unbelievable. So it is to say to you, you are on the right course as a country in terms of delivery of services. And the way also you are training your students is also experienced by people like me from another country who say, from Dodoma Hospital, I went to Aga Khan, to the specialized care, then later to South Africa. Today I can walk, even though I walk with support. So I wanted to say thank you.
Thank you very much, Excellency High Commissioner. You touched my heart, actually. And always, whenever I speak with you, even last time when we met, during some minor crisis, you touched my heart the way we spoke. And our countries, our two countries, have a very special relation, as you know. But secondly, it's great, and Professor Hongera, you have an ambassador, High Commissioner, as a testimony. That is something. I hope you will be able to use that mileage, because it's a very high mileage. Kwenye loyalty program, kwenye ndege, yani una extra. I hope you're going to be. I was checking that center. The first one in Africa is called Mill Park Net Care. Mill Park, but this is number one, top voted. And number two is Chris Hani in Soweto. Yes. Yeah, in the internet, the story is written. Chris Hani was because of what you have gone through. It became trauma, because you are very traumatized before. It's part of the history, and that's why we have Mazimbo, Liberation Committee, all that, because it's our memory together. I told you last time, it's a umbilical cord connectivity between South Africa and Tanzania. So we cannot deny it. But today, Mill Park has been nominated as top 7 centers in the world. Trauma. For those who are in education, please go on the internet. Baadaye accident ya mtu alikatika vipande viwili kwenye mining accident, alikatika yani upande huu. Mill Park waliweza kumuunganisha tena, imekuwa kama robot na welding. Maengineer wanaunganisha robot, hawa ni binadamu. Ilifanyika operation hiyo Mill Park, ambayo ndio imevunja rekodi ya dunia. This broke the world record in Mill Park. So if we can have, you have an agreement with South Africa? You have. Do you have an agreement with Mill Park? Help them to connect with Mill Park. If we can get 2 to 3 doctors, because our road accidents are also an issue. You saw the last one in Arusha, I don't know, Babati, the one in Mbeya, Iringa. We are full of road accidents every year, and we are receiving a lot of condolences from your president to Madam Samia for road accidents. They go through my table. Sometimes I don't know, because I don't have time to read newspapers or television, but I know from the condolence message which passes to go to Madam Excellency President. I know, there is an accident in Tanzania. So if we can help us and help them, I'm now on this side, to connect with Mill Park direct. For trauma, if we can get 2 or 3 doctors a year for trauma, and I can talk with my brother if needed, Lamola, on supporting each other, I'm ready. Na mimi niko tayari kupigia debe. Kila la heri.
Thank you so much. Thank you for the questions and for the contribution. And this marks the end of the panel discussion. And so we have one last session before we close, and I'll hand over the mic to Ellen.
Madam Amref, sorry. I didn't recognize you. My sincere apologies. Because you are very colorful, that's why. And I'm colorblind. You can tell them how much we worked together when I was in Zanzibar, and she really supported me to be a good health minister. Like the way Mama Mula Mula is supporting me to be a good foreign minister by mentoring me. But she really supported me in Zanzibar. Amref, asanteni sana. African Medical Research Foundation. Thank you.
Thank you very much, Your Excellency. Another round of applause for him. I think it's because of time and people are a bit tired, but people would have loved to stay for more because that was very interesting. Asante sana. We have just two things before we complete. I would like now to welcome Ms. Masha Makata Yambi, and she's going to give a vote of thanks. And then we'll have a token of appreciation to a few of people here. Karibu sana.
Honorable Guest of Honor, His Excellency Ambassador Mahmoud Thabit Kombo, Minister for Foreign Affairs and East African Cooperation, United Republic of Tanzania, all protocols observed. In the essence of time, I'll go to the main areas. As we draw the curtains to a very near close in today's timely and insightful forum on advancing global health through international diplomacy, it is my distinct honor and privilege on behalf of the convocation and in my capacity as the president of the convocation and also the vice chairman of the MUHAS Council to offer these closing remarks. Let me begin by expressing our deepest gratitude to each and every one of you, the diplomats, the policymakers, the researchers, development partners, and more to our panelists during our morning session, whose presence and your participation have made today not only possible, but truly impactful. Today we met at a critical intersection of global health. We know we have also climate change, geopolitical pandemics, as well as so much of the conflicts around, but also health inequities and that continue to shape the global landscape. Our shared conversations since morning have reaffirmed that health diplomacy is no longer optional. It is essential. Over the course of today, we have explored critical dimensions, the role of multilateralism in building pandemic preparedness and universal health coverage, but also we have gone through seeing how both global and health being very huge and big terms, but still we can use this health as the bridge for peace, especially in fragile and conflict-affected areas. The importance of vaccine equity, we heard in the morning, technology transfer, and capacity building in the global south. The contributions from the academic institutions like my institution, MUHAS, is producing more knowledge, nurturing diplomacy-conscious health leaders, and advocating for health equity beyond borders. The discussions have been very much reinforcing the health diplomacy, and of course, the cherry on the cake was the speech from our guest of honor. As a University of Health and Allied Sciences, at the heart of East Africa, and we all try to go through knowing that East Africa embodies also Tanzania. MUHAS has critical roles to play. I'll mention few. Research diplomacy. MUHAS contributes cutting-edge science research in the areas which we heard since morning, but of course also human capital development. Our graduates serves not only in Tanzania but also globally. Partnerships through collaborations with institutions like CDC, WHO, where we also offer human people to work there through our many, even recent ones, our Professor Janabi, the famous one. We continue to see that MUHAS is being represented in platforms where knowledge meets diplomacy. Our mission transcends academics, and we are the bridge between local innovation and global health advancements. We remember the talk by, or rather the quote by Nelson Mandela, rest in peace. Education is the most powerful weapon which you can use to change the world. And we see how MUHAS is using that weapon to change the world. So from this forum today, we carry forward a number of action items. Strengthened capacity for global health diplomacy in our curriculum, research and community engagement, so that we're going to have also short and long courses. We're going to also encourage cross-sectoral collaborations between health professionals, diplomats, and security experts. We will proudly and boldly document and share Tanzanians' contributions to global health as part of Africa's voice in shaping international health policies. We'll increase our publications to mirror the population as well as also the disease burden that we have. We'll promote youth engagement in global health. Students must not only be trained, but also mentored to lead. And we'll take this seriously, as we have already done so. We'll also advocate for increased investment in local health systems with international support rooted in country stewardship and ownership. We're going to continue to embrace advancing health diplomacy beyond pandemics, embrace the technology, and as well as its transfer. We'll start organizing our next bigger, bolder, and to be more specific, beautiful engagement with the 55 consuls that are available in the country. We're going to package our storytelling for also in the same line of the bigger, bolder, and better ways, ever since, from the Côte d'Ivoire to South Africa and to many others. We're going to also continue to be ready in the upcoming inclusion and other inclusion of our health and other sectors in the international diplomacy. We're going to come through the guidelines. This is economic diplomacy for resilience, sustainable development, aligning well with our MUHAS strategic plan, particularly in our vision and mission. Deeper appreciation. So on behalf of the convocation, Muhimbili University of Health and Allied Sciences, allow us to sincerely thank you, the guest of honor, for the very thought-provoking speech and insights throughout, for all the connections. I said tumepata connections so za kitoto. Tunashukuru sana. To our distinguished panelists and presenters and also contributors throughout the scholarly materials, as well as also experiences that you have also had all along. To our international partners and diplomatic representatives for your solidarity and experience, even your patience in waiting up to now. We know we have taken all your time, but this is worth, not only to us, but also to the savor the Most Higher. To the organizing committee, faculty and volunteers for all your commitment, sleepless nights, to Mariam, the sleepless nights, but I know it is worth and it is also fulfilling. And above all, of course, to our students and the youth, particularly, for your passion, you give us hope. Your presence here, it means that we have somewhere where we can as well have a continuation and, of course, build the coming leaders. To quote our late UN General Secretary, Kofi Annan, he said, "Knowledge is power, information is liberating. Education is the premise of progress in every society and every family." So let's continue to ensure that we embrace knowledge, and of course, the knowledge that we have gained here, we wouldn't have read it anyway. Let MUHAS continue to be the incubator of that knowledge and progress. So when we leave this forum, let us remember that advancing health, global health, through international diplomacy is not just an aspiration, it is an imperative. Let MUHAS, through its convocation and the broader community, remain a beacon of leadership in shaping health futures locally, regionally, as well as globally. And allow us to conclude this many of the words, but very few to make it short, is let us go forward together, remembering that end of this day's discussion and of course contributions in advancing, with the theme of advancing global health through international diplomacy, is opening a clear to-do list that I've tried to elaborate, or rather to share, but also is making the PPP in health and in all fields for stronger society as a must, and without leaving the already existing political will. Asanteni sana. Thank you very much. May God bless MUHAS, and may God bless us all as we depart here. Thank you very much.
Thank you, Ms. Masha. That's the president of MUHAS Convocation. Asante sana. Now we've gone close to an end. We have some few token of appreciation. To begin with, we want to appreciate our guest of honor, the ambassador. I would like the high table to stand up, all of them. I have a knowledge of something also. Today is a very special day for our guest of honor. I have come to understand that it is his birthday. So I like us to stand up and sing for him. If everybody of you can stand up and we can sing for him. That's our first present to him. We can, happy birthday to you. Happy birthday to you. Happy birthday, dear Tony. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. Thank you very much. Thank you very much. Now the rest of you, asante sana. We truly appreciate that. Thank you very much. You can now take a seat. We truly appreciate that you have been able to come during this special time. But then I will ask, as we said, we have a token of appreciation for him. May I ask the person involved to come and bring? We have a token of appreciation to the... We will ask the Vice Chancellor to present it to him. Please, can you bring the... Yes. This is the appreciation award presented to His Excellency Ambassador Mahmoud Thabit Komba, Minister of Foreign Affairs and East Africa Cooperation, in recognition of your special address on advancing global health through international diplomacy. Asante sana. Thank you very much. Asante sana. We will also like to, we have also other appreciations. We will ask the ambassador to give to them. The first one is to our president of MOA's convocation, Ms. Masha Makatayambi. We would like to acknowledge him for her transformative leadership. Transformative leadership